It's a pleasure and an honor to introduce our speaker on today. Tiffany Robinson is originally from Sikeston and have lived in New Madrid, Missouri for 6 years. She graduated from Southeast Missouri University in 2011 with a bachelor's degree in social work. Since graduation, Tiffany has worked in the mental health field as a case manager uh, for outpatient day habilitation program for those that suffer from mental illness, and has worked with the Division of Developmental Disability for the last 7 years. Tiffany began working in 2016 for the County Disability Resource as a supervisor, and eventually as the Assistant Director of Support Coordination for New Madrid and Pemiscot counties. Her goal and passion in life is to help individuals reach their full potential and live the best life they can. I introduce to some and present to others, none other than Tiffany Robinson.
And yeah, like Miss Nan said, my name is Tiffany Robinson, and I work for County Disability Resources. Our agency provides targeted case management services to folks with developmental disabilities. We serve individuals from birth all the way throughout their life. The youngest kiddo I've got's a couple months old, and the oldest gentleman we work with is in his 80s. So our main goal is to really work with folks throughout their life, like Ms. Dan said, to really try to pull out that potential and connect them with services and supports to help them be as independent as possible. County Disability Resources serves New Madrid County, Pemiscot counties, and Perry County, but there is an equivalent of us in all other counties. So if you guys live in counties outside of the ones that we cover, the information that I'm going to provide today, there is an equivalent of us in your area. Please feel free to reach out to me if you need to know how to get connected to those services if you're outside of our county, and I will definitely be more than happy to help you guys out. So I got really excited when Miss Nan and Miss Frida had kind of reached out to me about doing this. Because I really think that the services that we can provide can be extremely beneficial to individuals caring for loved ones. Especially sometimes in you all situations, I know that there's a lot of unexpected things that can arise. And we're kind of here to help navigate some of that stuff. So what we're going to talk about today is understanding what support coordination is. Support coordination is also referred to as targeted case management, but specifically what it looks like with folks with developmental disabilities, which is the population that we serve. So what is a developmental disability? The state defines a developmental disability as somebody having an intellectual disability, a physical disability, so things such as cerebral palsy, Down syndrome, autism, anything that's related to brain dysfunction or mobile limitations. And the way to qualify for services with us is that this diagnosis has to be given before the age of 22. So if you all have loved ones that you're caring for, obviously most of them are probably under the age of 22. So if they've been given some form of developmental diagnosis, this information could be very beneficial to you all. The state also looks at a developmental disability as something that is likely to continue indefinitely. So a lot of times I get asked questions about, if someone maybe breaks their back, what can we do with those types of things? That's not really in the scope of things that we work with. It has to be something that's going to be foreseen as going on for the remainder of their life. They also have to show limitations in various areas of their life. So some of those areas are self-care, receptive and expressive language, learning, self-direction, capacity for independent living, and mobility. And what this really does is it reflects the person's need for a combination of services. So basically, when we're looking at someone to see if they qualify for targeted case management services, we're trying to look at all the areas of their life and see where maybe they're a little bit behind, where they're needing some more assistance to really be able to fully participate in those areas. So we get a little bit confusing sometimes, and or we get a little bit confused sometimes with Department of Mental Health. A lot of times I'll have folks ask me or come to me and say, you know, my child or my loved one has ADHD, for instance. And that's not really a diagnosis that we work with on this side of things. So I did just want to quickly touch on the structure of how the Department of Mental Health works. So the Department of Mental Health is primarily who we work through. However, there are two separate divisions of the Department of Mental Health. One being the Department of Developmental Disabilities, which is what my agency covers, and the other side being the Department of Mental Health. So, if you all have loved ones who maybe do suffer from ADHD, depression, anxiety, those type of mental health related issues, there is a separate side and separate services that go with that. However, I cannot stress this to you all enough. I am here to be your resource. So feel free to reach out to me, because even if your loved one is suffering from those things, just because I can't help doesn't mean I can't point you in the right direction on who you need to talk with. So most of the time, if your loved one gets a SSI check, Social Security has determined that they are developmentally disabled. Most of the time, they do qualify. Since we aren't the agency that actually determines eligibility, and I'll get into that in just a little bit. They don't give me the golden book of qualifying things, but I can tell you based off of my experience and things that we've seen is yes, sir. If Social Security has determined that someone is has a developmental disability, they typically qualify for services with our agency. So yeah, so kind of going back to the, like I said, the delivery structure system. So again, we are under the Department of Developmental Disabilities. And as I told you guys earlier, there is an equivalent of my agency in every county in the state of Missouri. There are 6 main regional offices that cover the area, and that's who we primarily communicate with, again, to determine those eligibility requirements for case management services. And the state also determines eligibility for funding sources and things that we'll get into a little bit later. So the tier kind of goes Department of Mental Health, breaks out into 2 divisions. Over here we have Department of Developmental Disabilities, and then the targeted case management programs serve under them. So in the areas that we serve, again, like I was telling you guys, most counties have a targeted case management agency that is local. Dunklin County, for instance, the state still does their targeted case management services, but the state is actively working towards moving those out to more local and private agencies like CDR. And one of the main reasons for that is because when the state was doing those services, as many of you may remember or recall, they weren't really familiar with what's going on in our area. So having divvied this out to local TCM agencies has really helped kind of bridge that gap for things just like this. We can make these connections with groups like you all. It's a lot easier to access. We have those really good relationships to be able to advocate. Again, my supervisor put this on here. He loves "this is not how we advocate," and apparently booyah, because I'm pretty sure he did that too. So he's going to get a kick out of the fact that did that 3 times. And then also because some of the funding services that we tap into are local as well. Every county has a local Senate Bill 40 board, and that is who determines who does their case management agencies. And you all, as local taxpayers, also pay into tax money that is supposed to be divvied out to help folks with developmental disabilities. And our agency is kind of the gatekeeper to some of those funds. So again, having those local agencies really helps us to access that funding and help build more resources in our community. So the main thing that we do is we try to connect folks, like I said, with services that help them grow, learn skills, just remain safe sometimes. So we do differ from what you guys may know as like in-home services, because I'm sure you guys have lots of those agencies in your area where you live. And a lot of those are through a different branch of services where they actually come in and they do things for folks. They may cook for them, they may clean for them. And the services that we connect with here at County Disability Resources are really more focused on skill building. So some of the main funding sources that we try to connect folks with with are referred to as Medicaid waivers. I'll dive into the eligibility and stuff briefly later, but just know that that is kind of the main funding source that we try to connect folks with, because that Medicaid waiver will fund services above and beyond what basic Medicaid pays for. And we will get into what those look like. Another main funding source that we work with is referred to as Pac Funds. This pot of money is specifically for folks with autism diagnosis, and this money goes towards connecting them with services and agencies that are specialized to work with folks with autism diagnoses. Again, those SB 40 funds I kind of touched on a second ago. And then also we look into all sorts of other just outside what I kind of refer to as the nitty gritty case management stuff to find any type of other services that we may need, whether it's looking into local, if we need to contact DAOC to help out with maybe some rent assistance or some light bills or things like that, all the way to like I work very closely in New Madrid County with the Resource Center. They have a bank program going on. So a lot of times we will work with local agencies as well to pull in those services. I know I've reached out to Miss Frida Kershaw several times just to see what FCC's got going on. So basically anything that the individual needs in their life, our role is to connect them with that. The main thing to keep in mind with these services, though, is that the need does have to be directly related to their developmental disability when we get to requesting things such as the Medicaid Waivers services. I did want to touch on the Lopez waiver. So obviously, in order to qualify for a Medicaid waiver, the individual has to have Medicaid. But there are times where you may be caring for someone and they don't qualify for Medicaid due to maybe too much income coming into the home. However, there is a waiver that is set aside for those types of individuals. If they just have very severe medical needs or behavioral needs, but they just don't qualify for Medicaid because of funding reasons, we can look into requesting what they refer to as a Lopez waiver, which actually kind of bypasses that barrier. And if approved, the individual would then have active Medicaid and can receive those services that we need. So I did just want to touch on that before we kind of dive into the paid supports, because I know sometimes people may not qualify for Medicaid, but just know that if you do have a loved one who doesn't, but has those significant behavioral barriers or medical barriers, that there's still a route that we can look into. So support coordination is, again, like I said, referred to as case management. We refer to our case managers here as support coordinators, and they have four primary functions when working with an individual. The first one is to plan with the individual. And when we say planning, we are going to sit down with you and your loved one, and we're going to talk about birth all the way to where we're at now, every area of life. And during that planning process, it's very important that the individuals that we speak with are very honest about the struggles that they are facing, because our job is to help overcome those barriers. We can, throughout the planning process, really try to identify treatment team members to make sure that everyone's on the same page as well. I always laugh, I say we're kind of the middleman between everybody. We try to make sure that what's going on in the school is then transferring over to what's going on maybe in the home when the individual has personal assistance. So identifying that treatment team, maybe connecting with other individuals such as mental health providers and things like that. We also conduct various assessments to get a further, more in-depth look at specifically where limitations are. And then we have various meetings and observation to really try to get a picture of what's going on with the individual. The second piece that we really focus on with support coordination is then monitoring. So we're not going to say, Miss Lisa, I'm going to connect you with some personal assistance, and we're going to get these people coming in your home that you may not know, and good luck, see you later. What we're actually going to do is we would sit down with you. We would identify what goals we want to reach by connecting the individual with those services, and then specifically what you want to see happen. So primary example would be if we connected someone with personal assistance because we want Johnny to improve his independent living skills. then we as a treatment team will determine, well, how do we want to do that? Well, maybe we want staff to work with him on learning how to appropriately communicate, learning how to, learn safety skills in the home, things of that nature. And then the support coordinators come back and they continuously monitor those services throughout the year to make sure that the agencies are doing what we've identified, that we're making progress, that everything's going good, and then we can adjust everything throughout the year if needed. So the third thing that we do is we are responsible for, again, linking individuals with things that they may need. So, kind of like we talked about earlier, making those other referral sources, maybe contacting DAOC if we need some assistance with rent or light bill or something like that. And then advocacy. And when we say advocacy, we really mean not necessarily going in and tearing down everybody, but to really advocate for that person, to try to get them the services that they need through communication and cooperation with outside folks. So this can look like assistant with appeals if we put in a request for a service and the state determines that they don't believe that it's justified, they will deny that request. And then our agency assists the family throughout the entire appeals process to advocate for those services. We also, again, attend IEP meetings because, as we all know, sometimes that's like reading Greek. And again, sometimes what's going on in the school maybe isn't crossing over with what's going on in the home. So we can sit in those meetings too to help kind of navigate and get everyone on the same page. And then I'm sure for those of you that deal with Medicaid, you know how lovely it is to sit on the phone for 15 hours and then maybe get someone to answer. Or you get denied multiple times and you don't know why, especially if the person's already had active Medicaid. And so we can step in and advocate on that level too. We've reached out to state representatives regarding that type of stuff. So just basically anything that the individual needs. My client has a grandchild. He's 18, but will be graduating next year, but he's disabled. How do we get him connected? He has an IEP. Perfect. And I will get into that in just a second whenever we dive into kind of what the intake process looks like. Because depending on what county this individual resides in will kind of depend on the route that you need to go. But again, guys, if during this meeting, because this is going to be a lot of information, if you have questions, concerns, Miss Alice and Miss Ann, they can send out my contact information and you guys reach out to me and I'll help you navigate that stuff. And so for in New Madrid, you will actually contact me and I'll go through that in just a second. So perfect. That works out well. So again, kind of going in a little bit in depth, a little bit more, we kind of talked about this, so I won't go into it, but kind of what our SC's role is in the planning. So we are here to facilitate various meetings. Again, we are the middle person, so we try to get team meetings together as much as possible. We attend and actively participate in anything that the individual needs us to. The parent and guardian's role is to attend and actively participate in these meetings and really be open-minded about what the individual can do, and then allow us to kind of educate you. I know so many times when you're working with an individual that has a developmental disability, a loved one, it's scary to have somebody come to your house to watch them, especially when they can't speak and they maybe don't understand those consequences. And so, just kind of keeping an open mind with things, letting us kind of ease into those things, talk about different options. And then the services agencies that we may connect them with, their role throughout this planning process is the same as the parent and guardian, but also to really kind of help ease those fears. A lot of times we will schedule, I just call them interviews basically, where the support coordinator may block out a whole entire day where they would meet with you and all the providers that are available for a certain service. That way you can meet that person, you can feel out them, see if your personalities mix, if you feel that trusting vibe. So we can do all kinds of things like that to make sure that you guys feel comfortable with moving forward with services and things that we may request. This was just some more support coordination functions and some websites that you can go to. The Missouri Division of DD, again, those are kind of our top dogs who we work with and who we answer to. Medicaid information. The waiver manual will describe more in depth the Medicaid services that we can connect folks with. And then just keeping in mind too that the Bureau of Special Health Care Needs and the Department of Health and Senior Services are also very good resources to access if you all have individuals with developmental disabilities, because those are the services that can connect folks with maybe like those in-home services. If somebody actually needs somebody to come in and cook for someone, bathe them, do things like that. So the monitoring aspect that we do once we connect folks with these services, like I talked about earlier, we don't just throw you to the wolves and say good luck. And we do a lot of extensive monitoring through reading daily case notes, monthly summaries that line out specifically what the staff person did with that day. And the support coordinators are looking to make sure that the individuals are following those treatment plans. You know, that you don't just have Becky who shows up on her cell phone and sits there all day and gets paid for it. We really dive in to make sure that these are very productive services. We also typically only review things every couple months, but we can always jump in at every time, anytime if we feel that it's needed. And then we also talk with the individual and the guardian every couple months too, to just go over various areas of the life to make sure, because I know sometimes things can be so overwhelming and somebody may call and say, how are things going? And then you hang up and you're like, oh my goodness, I forgot that having all this problem with his therapist. So the support coordinator will come and kind of go through various areas of the individual's life with you all to make sure that there's nothing that you need at that time. I am not going to get into all of this kind of stuff, guys, because we just kind of got there, but creativity is key. My boss loves these cute little things. I don't know how to make them. So, but we try very, very hard to get creative. An example I can kind of give you is we have an individual that we work with who was in desperate need of a vehicle modification. And we had been trying several years. Of course, the state has a funding cap on what we can request with that. And so the support coordinator did an excellent job with reaching out to multiple different sources to get money and come all together to get this for that person. So we try to be very outside of the box thinkers to get needs met. So going back to the Medicaid waivered services, which are the main things that we try to connect folks with, that will be extremely beneficial for you all and anyone caring for an individual with a developmental disability. We can look at things such as assistive technology. This could be if, for instance, she has an adult child that she's working with that's 18. Say that it's probably not best for him to be left alone, you know, when grandma runs up to the store for a couple hours, because he may not know how to respond if somebody knocked on the door. But he would if he had the option to. So we can look at things what we refer to as like remote monitoring, which means if Johnny was at home by himself while grandma ran to the store and someone came knocking on the door and he got nervous, he could push a button and have immediate access to someone who could talk him through how to handle that situation. Behavioral analysis services are another big thing. We work with behavior therapists who are specialized with working with individuals with developmental disabilities to overcome some of those behaviors. And when I say behaviors too, it doesn't necessarily have to be negative behaviors. Obviously, those fall in there. But even, you know, some of our kiddos with autism have a lot of overstimulating behaviors. They are very they have sensory issues that are very, very almost debilitating at time for them. So those are types of things that these therapists can look at too, and can request maybe some equipment or something to help overcome those type of stimming behaviors or oversensory behaviors. We also look into environmental accessibility adaptations for the home and the vehicle, which means if you have a loved one that you're caring for who, say, for instance, is maybe in a wheelchair and your bathroom just really isn't, you can't get the wheelchair in, you're about to break your back every day trying to lift and get them in and out of the tub, we can actually request a home modification to come, or a contractor to come out and complete a home modification to make that bathroom accessible for the individual. All the way to, we work with a little boy who can walk some of the time, but not always. And we got handrails all throughout the hallways in his home, so he can try to walk throughout the home that way. Wheelchair ramps, wheelchair lifts for vehicles, things like that. And I do want to throw out that all of these services that we're discussing that are funded through the Medicaid waiver, um, are of no cost to the individual. It also doesn't affect benefits or anything like that. Again, if approved for this Medicaid waiver, it's just an extension of the individual's Medicaid. Community integration services, OT, PT, which is occupational therapy, speech therapy, physical therapy services, or assessments for maybe various equipment. And then personal assistance really tends to be the main service that we connect folks with. And this is going to be where you have an individual come into the home to allow you maybe time to go shopping or go to a movie by yourself for a second, go on vacation with your girlfriends and do something fun. You can have someone come in the home to ensure that your loved one is looked after. And also throughout that, they're still learning. They're trying to work with them on skills because personal assistance, the main thing is to help improve those independent living skills with folks. And this can be through an agency, or we have what is referred to as a self directed program, which means you, as the primary caregiver, could be the individual in charge of determining hiring and firing staff, what the schedule looks like, and things like that. Because, again, like we said, I know the fear of sending your loved one out with someone that you don't really know, and this is kind of the perfect program to meet that need. Professional assessment and monitoring is some nursing services. We can come out and do a little bit of education, maybe if the individual has diabetes or something like that. When the individual gets to adult age, and maybe it's time to fly the coop, or the individual wants to do what typically developing 18-year-olds do, which is move out, we can look into residential services for those folks, which means your loved one could maybe live in an apartment by themselves, but have 24-hour staff all the time that have to show up for every shift. So you're not fearful that they're ever left unattended, but it allows them the opportunity to try to be as independent as possible. And at the same time, also allows you all as caregivers the opportunity to kind of move on to different stages of your life as well. Respite services are available. I will let you guys know, unfortunately, as most of you know, down here in the lovely Boot Hill, we do not have a lot of respite providers. But those personal assistant services can be utilized as kind of what you guys may be familiar with as respite, which is just giving you that break for a little bit. Specialized medical equipment and supplies. If you guys care for loved ones who still are not potty trained, but say they're 5, 6 years old, you need extra wipes and gloves and things like that, we can request kind of that sanitation stuff for you. And then the transportation services are typically coupled, they are always coupled, I apologize, with another service, typically personal assistance. But that means, that if, say, you work with, or you have a loved one at home who's 18, 15, 14, the personal assistant could maybe take them to the store and work with them on how do you create a meal plan? How do you compare prices? How do you shop? Let's work on giving and receiving correct change. So they can take them out into the community as well. If you have a loved one who maybe you can't utilize the Medicaid transit service for because they maybe exhibit some behavioral concerns, the personal assistant can accompany you to those doctor's appointments, to those therapy appointments to help redirect and help kind of look after the kiddo while you guys try to communicate with the doctors and therapists. Another service that is, oh goodness, that is not on here that is very beneficial to the children's age range and after is what we refer to as day habilitation services too, or day program services. And basically what these are services where kiddos can go. It's usually about 8:30 to 2:30, and it's like school, but they go and they learn independent living skills. So they may get there in the morning and they may go over hygiene, or at lunchtime they may be assisting with preparing the lunch meal that day. They work on socialization skills, and it's very beneficial for kiddos because you can access this like during Christmas break, Thanksgiving break, any day that the school's out, when you guys probably are sitting there going, awesome, what am I going to do? I have nowhere for the kiddo to go. And unfortunately, with our folks with developmental disabilities, long extended breaks can really cause a lot of regression, and accessing those day habilitation services can be very beneficial in keeping the child on track with their skill level too. So Does anybody have any questions about these specific services? Because again, these are kind of the main things that we try to connect folks with. And I know that's a lot of information too at one time. So kind of getting into the eligibility information now. So in order to qualify for targeted case management services, which is what our agency does, the individual has to have a qualifying developmental disabilities diagnosis. Unfortunately, I don't have that magic list because the Department of Mental Health is the one who ultimately determines if someone is eligible. So they don't give us that info. Again, it had to occur before the age of 21. And during the intake process, there will be assessments completed. If the individual has a Vineland maybe already done at school, they may look at that, but they will conduct assessments to see if this person has a a limitation in at least two major areas of their life. And so getting into kind of what Maddie was saying, so if you have somebody who meets these eligibility requirements, you think, if they reside in New Madrid County, Pemiscot County, or Perry County, you all can actually contact me directly. For those of you who work with other individuals and maybe you're not the primary caregiver, if that person is good with you passing along their name and contact information, I will then actually reach out to folks and try to schedule an intake with them. Our agency noticed a couple years ago that, especially down here, unfortunately, you guys know how great our mail is. Good luck if you get it sometimes or see in 2 weeks. Um, but we really noticed that there were a lot of people falling through the cracks and were not getting services that they needed. So we have an agreement with the Department of Mental Health where our agency can assist with intake applications, which means I can come to you, I can verbally ask you all of the questions that are needed for the intake, obtain your signatures. I'll turn all the paperwork into the state that day, and then I can kind of be your middle person to assist you throughout the process in case you have questions or need anything like that. If you reside or have individuals that reside in any other county in the state, you do have to contact your local regional office to go through them. So on here, you'll see it's the Sikeston Regional Office. They cover the southern counties. So I believe it is Mississippi, Scott, Cape, Madison, Dunklin, Perry, New Madrid, and Pemiscot. But again, if you're outside of those counties, I can still point you in the right direction. So just reach out to me and I can tell you the name and number of who you need to contact. But again, if you reside in New Madrid, Pemiscot, or Perry County, please reach out to me. And so we can help assist with that intake. We also, for those of you who work with other folks, I'm really good about following up and super stalking, like I say. So I won't just call one time and they don't answer and that's the end of it. I will call multiple times to try to make connections. So in order to qualify for the Medicaid waiver funding services, like the TCM services, you have to have that diagnosis. It has to be given before the age of 22. But the difference is instead of only needing 2 areas of deficits, you actually have to have 3. And then obviously you have to have active Medicaid. But if you have all of those things, we can then put in that request for that Medicaid waiver to fund all those services that we just went over. To touch briefly on the Pac funded services for our folks with autism, all you have to qualify for that service is just an autism diagnosis. You don't have to have Medicaid at all. You don't have to have insurance at all. Doesn't matter what kinds you have. If the individual has an autism diagnosis, our support coordinators can immediately request those services. So I do want to let you guys know, though, too, speaking of autism, um, the state does not typically recognize a medical diagnosis of autism. So if your pediatrician has diagnosed your loved one, your child with autism, a lot of times the state will not recognize that. So if you guys do have one of those diagnoses, I would encourage you all to reach out to an autism diagnostic center so they can do the formalized autism diagnosis because then that would be recognized by the state and we could look into TCM services and accessing those Pac funds. So, okay. A big thing that we try to focus on for our school aged kiddos is definitely transition services. And the biggest fear is when your loved one with a developmental disability is getting ready to graduate from school, what do we do at that point? Do we stay at home and we do nothing? Or could we look into other things like personal assistance? Maybe, looking into employment services and things like that. The sheltered workshop is sometimes appropriate for some of our folks, but we also can connect individuals with supported employment services to integrate them in the community. So during those transition services, it's very important because as we're planning for life, things moving forward, we can be sure that we ensure that there's an after plan after school. We can make sure that once they get done with that, they have a plan. But then we also take it a step further to look at those kind of big picture. And I hate to say this is always like the worst part of the conversations that we have with families and folks, but to really kind of talk and plan about what would happen if something were to happen to you. So we can look at things like special needs trust financial plannings. What's the long term plan? Making sure that we maybe have that written up somewhere, that your loved ones have that, that the people who need to know that have that, so we can ensure that your loved one is cared for as you would like them to be if, again, something were tragically to happen for you or happen to you. Um, Guardianship is another thing that I really just kind of want to touch on because where we are very strong advocates for folks to maintain their own guardianship through supported through a support team and really having that system in place to help them make those safe decisions for themselves. There are times when that isn't appropriate. So I just want to kind of throw that out there for you guys who maybe have kiddos that are reaching the age of 18. Just because you may be guardian now or appointed, as their caregiver now, once they turn 18, unless you legally have that stuff kind of lined out, they then become their own guardian, which can cause problems if it's not appropriate for that individual. So I do just want to kind of throw that out there that if you guys have people or individuals that are creeping up on 18, to really maybe be planning for that now. Okay, so again, like I said, we are here for from birth until death. We're here for anything that you guys need to help the individual succeed in life. I will put all of my contact information in the chat box. And then, but Alice, Miss Nan, you guys feel free. You better send that stuff out however you need. And again, if you all do not reside in the counties that we cover, just know that there is an equivalent of us where you're at. So please just reach out to me. So thank you guys very much for letting me present today.